Good morning, everyone, and thank you for joining us this morning. My name is Glenn Malabuick, and I'm a senior benefits analyst with Lacers, currently working in the health benefits buyback and wellness division. And this morning we'll be going over the Medical Premium Reimbursement Program, otherwise known as the MPRP. So this morning, just a quick overview of some of the general topics that we will be covering. We'll be going what is exactly the MPRP, who is eligible, guidelines for your non-LACERS coverage, what is a qualified health plan, and what is eligible for reimbursement, how to enroll in the program, and that involves cancellation of your LACERS coverage, how to enroll during or after retirement, what the application process entails and the required documents that you'll be submitting, submitting a claim for reimbursement, and I'll be going over our reimbursement schedule as well as our claim form and the proof of premium that you will need to attach for your claim for reimbursement. Other topics that I'll be covering, medical loss ratio and plan rebates, Medicare, and lastly, eligible survivors. And again, as Gabe had mentioned earlier, at the end of the presentation, we'll have a Q&A session. You could currently access our Q&A through the Zoom button found at the bottom of your screen. There should be a Q&A section next to the participants button. Feel free to ask questions during the presentation, and a staff member will either respond to you or I'll try to answer the question live at the end of the presentation. All right. So what is the Medical Premium Reimbursement Program? Well, this program was established to assist retired LACERS members and eligible survivors who are unable to access one of our California HMO medical plans due to residing outside of a LACERS-sponsored HMO or Medicare Advantage HMO plan zip code service area, and do not wish to enroll in our sponsored PPO option. Those who qualify for reimbursement may be reimbursed up to the maximum monthly subsidy for which they are eligible for, as long as their health insurance plan is a qualifying plan to be reimbursed. Eligibility for the MPRP. So again, as I mentioned, the LACERS Medical Premium Reimbursement Program is available to retirees and eligible survivors if they meet all of the following criteria. First, you must reside more than 3 months out of the year, either outside of California and within the US and its territories, or within California, but outside of an authorized zip code service area of one of our LACERS HMO or Medicare Advantage HMO plans. Your home address is based on what we have on file for you with LACERS. So if you do reside 3 months out of the year, ideally it should be 3 consecutive months of the year that you reside outside of a service area. Next would be your minimum city service. You must have 10 whole years of city service and be at least age 55. Both of these 2 requirements are minimum requirements in order to receive a medical or health plan subsidy. And of course, if you're participating in the MPRP, you must not be enrolled on a LACERS medical plan at the same time. Your non-LACERS medical policy that you enroll in must be either federally qualified or state regulated medical insurance plan. Additionally, if you happen to have purchased your non-LACERS medical coverage through the health insurance exchange, you must not be receiving a state or federal subsidy or a tax credit. So general guidelines for your non-LACERS coverage. Now, provided that you meet all the program qualifications, you'll be eligible for reimbursement of the medical premium you pay for the following. As I mentioned, a state qualified individual plan, and that you must not be receiving a federal medical premium subsidy or tax credit through the health insurance exchange. A medical plan sponsored by an active employer. So if you happen to move out of state and decide that you want to work beyond retirement and you're able to secure health coverage through an active employer, that would be reimbursable as well. A medical plan sponsored by a retirement system other than LACERS, and a medical plan sponsored by any other City of Los Angeles retirement system, such as fire and police pensions or DWP. If you are covered by a plan from one of those retirement systems, limits may apply in terms of your medical subsidy amounts. To go over just real briefly, a state qualified medical plan. When I was mentioning earlier the health insurance exchange, health insurance marketplace. So what that is that it's a service that's available in every state, and it helps individuals and families and small businesses shop and enroll in affordable medical insurance. And when you fill out an application for the health insurance marketplace, you might find that you're able to qualify or save money through offers of tax credits or medical subsidy. So again, just to be sure, if you do purchase a health insurance plan through the insurance exchange, that you must decline and not receive a federal or medical premium subsidy or a tax credit. Okay. So what is a qualified health plan? A qualified health plan is a medical plan that provides essential coverage and follows established limits on cost sharing, such as deductibles, copays, and out-of-pocket maximum amounts. Essential health benefits should include ambulatory patient services, emergency services, hospitalization, pregnancy, maternity, and newborn care, mental health and substance use disorder services, prescription drug coverage, rehabilitative and habilitative services and devices, laboratory services, and preventive and wellness services. What is and what is not eligible for reimbursement? So as we went over earlier, your medical plan premium is eligible for reimbursement. And if the medical plan that you are enrolled in does not include prescription drug coverage or vision coverage, and you have to purchase a supplemental prescription drug coverage and or a supplemental vision plan coverage, those premiums would also be eligible for reimbursement. Types of coverage that would not be eligible for reimbursement. So dental plans. Dental plans are not reimbursable under this program. If you happen to move out of state, LACERS does offer the Delta Dental PPO coverage, and that should provide you with dental coverage throughout the United States and its territories. Long-term care plans are not reimbursable. Catastrophic health plans Those are also not reimbursable. Health savings accounts. These are not reimbursable as usually health savings accounts. They're mostly designed to cover preventative services before a deductible is met. And the untaxed dollars in the account, they're usually used to just pay for the expenses, but not the actual health premium. And then lately, there's been a rise in healthcare sharing ministries. This is also not something that's reimbursable. Healthcare sharing ministries is they're membership groups which require members to pay monthly amounts similar to those of premiums, but the funds that are gathered for health sharing ministries, they're used to pay medical services for its members. So it's not necessarily major medical insurance and not providing essential coverage. So things to note, after the reimbursement of your primary medical premium and that of your dependent, any remaining subsidy may be used to reimbursement of your supplemental prescription drug coverage and your supplemental vision plan premium as well. LACERS does not apply your medical subsidy towards the reimbursement of any copays, deductibles, or the balance of medical services that you receive. How to enroll in the MPRP. Okay. So as I mentioned earlier, you may, in fact, participate in the MPRP at any time. However, you must not be enrolled in a LACERS-sponsored medical plan at the same time. So it's important that before exploring the option of participating in the MPRP, that you do submit a medical cancellation form in a timely manner. And also you want to ensure that you have adequate coverage prior to canceling your medical insurance with LACERS. When you do submit a cancellation form, your health plan coverage with LACERS doesn't terminate on the actual day that you submit that form. Your LACERS coverage will continue upon the last day of the month. For example, if you submit a LACERS cancellation form for the month of September, the plan would essentially cancel September 30th. And the idea is that if you're participating in the medical premium reimbursement program and enrolling in non-LACERS coverage, that you don't want to have a gap in coverage. So it's important to let LACERS staff know so that we could work with you, making sure that your LACERS medical plan cancels on the last day of the month and that you do have non-LACERS coverage starting on the 1st of the following month. And then a special note here at the very bottom, if you are participating in the MPRP and for any reason during the year that you cancel your non-LACERS medical coverage, you cannot re-enroll in a LACERS health plan until the LACERS annual open enrollment period, or unless you experience a qualifying event. And you may refer to the LACERS Health Benefits Guide for what constitutes a qualifying event. Just to go over some of the basic scenarios of a qualifying event, they could include a life event, such as a marriage or adoption or birth of a child in retirement. Other things of a qualifying event would include 30 days of a relocation, 30 days of a zip code service area in which you are in that suddenly becomes available or non-available. So say you are living in California And at the time you are participating in the MPRP, if suddenly your zip code service area that you're living in, if a LACERS health plan is now available in that zip code, that would be a qualifying event. 30 days of being involuntarily terminated from your medical plan. Let's say that you have non-LACERS medical coverage, and for some reason there is a merger, or the network of your medical plan is suddenly canceled and you're forced out of that plan, or being let known that your coverage will be ending. That would be a qualifying event as well. And then 90 days of turning age 65. And we'll go over Medicare in a few slides away, but 90 days of turning age 65 for a LACERS retiree would also be a qualifying event. Okay, enrolling during the retirement process. So if during the retirement process, you know that you'll be residing outside of a LACERS HMO service area, you want to let LACERS health staff know and allow staff to help determine if you are eligible to participate in the program. LACERS Health will send you a comprehensive MPRP information packet. And when you do that, when they do that, you want to be sure to read the information packet thoroughly and ask questions for clarity. You want to also start the research of available medical plans in your new area of residence and provide a copy of the summary of benefits to LACERS staff for the medical plan that you intend to enroll in. And then lastly, you want to submit a signed change of address request form to update your new address in our LACERS system. Enrolling after retirement. So very similar process. What you want to do is, if you are enrolling after retirement, you want to contact LACERS within 30 days of your move outside of a LACERS HMO zip code service area to allow staff to help determine your eligibility. Again, LACERS staff will provide you with a comprehensive MPRP information packet for you to review. You want to submit a signed change of address request form to update your address in our system. You want to research medical plans as well in the new area of residence and provide a copy of the summary of benefits for LACERS staff to review. And then if you are on a LACERS medical plan, you do want to submit a LACERS medical cancellation form. If you are enrolled in the Delta Care USA HMO dental coverage, you'll need to cancel that plan and switch possibly to the Delta Dental PPO option if you wish to continue dental coverage through LACERS. And if you are enrolled in a LACERS Medicare plan, one of our senior plans, you'll also want to submit a voluntary disenrollment request form. So required enrollment documents. When you receive your comprehensive MPRP information packet, it'll include a list of documents that you will be submitting as part of the application process for the reimbursement program. The required documents include the enrollment form, copy of a medical insurance certificate, copies of medical, prescription drug, and vision ID cards. If you're age 65 and over and have enrolled in Medicare, you want to provide a copy of your Medicare ID card. As I mentioned earlier, copy of summary of benefits for yours and your dependents' non-LACERS medical plan. And then if you haven't done so already and you are covering dependents, on your non-LACERS plan, or you're an eligible surviving spouse, you do want to submit a certification of dependent or survivor status for health coverage form. So what is a medical insurance certificate? So your medical insurance certificate provides evidence of your current medical coverage. If for some reason your insurance company does not provide a medical insurance certificate, an enrollment confirmation letter from the insurance company may be submitted in its place. A medical insurance certificate or enrollment confirmation letter should include the following: the date of the insurance certificate, name of the policyholder, effective date of the medical coverage, the type of medical coverage and plan name, a breakdown of the monthly premium amounts, the name of any dependents to whom the insurance certificate applies, medical insurance company name, address, telephone number, and contact information of the certificate issuer. And lastly, a signature of the issuer is required to be accepted. So simply put, you just can't go ahead and print all of this information on a Word document. It must be officially provided by the insurance company. And again, that would be either the signature, either on an electronic form to be accepted. Note that separate insurance certificates must be furnished for each dependent if the information is not identical for the LACERS member. Okay, so finally, we'll go over how the reimbursement process works. Okay, so first thing to note is that LACERS does have a reimbursement schedule, and very important that the LACERS reimbursement process is on a quarterly basis, not on a monthly basis. Okay, so we divide up the year into 4 quarters. The first quarter being January, February, March. Second quarter, April, May, and June. Third quarter, July, August, and September. And finally, the fourth quarter of the year, October, November, and December. According to the schedule, we have a certain time when we have a deadline in which we receive claims for the quarter, and also a time for us to review and process those reimbursements on specific monthly retirement benefits. Okay, so we do reimburse claims expected on May 31st, August 31st, November 30th, and February 28th. So when you're looking at this particular schedule for reimbursement, you do have to consider the financial impact that it could have for you. You can see here that if you are enrolled in January, and if you're enrolled in a plan and starting to participate on the program, just for instance, January, February, March, you can see that the actual reimbursement for the claim, for the proof of, for the premium, the insurance premium that you've paid for 3 months, the reimbursement is not provided back to you until May. So that could be almost 5 months of premium that you could be paying up front, especially if you're just starting out on the program. So that is something that you do want to consider and prepare for prior to enrolling on this program, is that premiums that you pay up front, they will not be reimbursed to you right away. There's a process and there's a schedule that's involved. Claim forms received after the quarter deadline. So if you do miss the deadline, they will be processed on the following quarter. So again, we try to assist members best as we can. We do understand that, especially during this past year, there's been delays in the mail, but typically when we receive claims at the deadline, we process them for the following month, as listed here in the schedule, and anything that is received outside of that deadline, we'll process that on the following quarter. Claim forms received after 12 months will no longer be processed. So again, you definitely want to keep track of all of the payments that you're making and submit claims in a timely fashion. We do have some members that wait to submit all of their claim paperwork on an annual basis. But if you definitely want to be proactive in keeping track and submitting claims in order to meet these deadlines. Okay, submitting a claim form. Now, once you're accepted into the program, you may request reimbursement by submitting a claim form along with the proof of premium payment. So here in this slide, you can kind of see a glimpse of what our claim form looks like. It's very basic. Basically, there's 5 steps on the claim form for information you have to fill out. You'll be checking the box for the quarter that you are submitting a claim for reimbursement for. You'll include your membership information. And then in step 3, you'll include your medical insurance, prescription drug information, vision insurance for the premiums that you're paying for the quarter. And lastly, you'll sign and date below. Acceptable documentation for proof of premium payment include copies of canceled checks, copies of redacted bank statements indicating the payee, monthly medical statements or invoices confirming monthly insurance payment, or payment confirmation emails from the medical provider. Okay. One thing that we do encourage all members who are participating in this program is to redact any personal identification information, just as a safekeeping of your information. We only need the information regarding the proof of payment. So anything else you want to redact that just in case. Note that reimbursement is only for premiums paid out of pocket, and these include again Medicare Part D, which is your prescription drug coverage, and vision insurance, as long as it does not exceed your monthly medical subsidy for which you're eligible for. Yeah, I just realized that one thing I did want to mention about the last slide, for submitting claims for reimbursement, there's a number of ways that you could submit claims for reimbursement. You could, of course, submit them through the regular mail. We'll also accept fax documents to our office. You could also submit claims via our LACER's secured site upload link. You could also scan and email copies as well through secured sites like Hightail for submitting claims. Sorry. Medical loss ratio and plan rebates. So in 2012, a provision of the Patient Protection and Affordable Care Act took effect, requiring medical insurance plans to spend at least 80% of premiums collected on healthcare costs and quality improvement activities. And the other 20% can go to administrative overhead and marketing costs. This 80-20 ratio is what's known as the medical loss ratio. So if your insurance company does not meet this requirement and using 80% of the premiums on healthcare costs, they actually must rebate you any shortfall of this threshold to its subscribers. So you may see a rebate in the form of a rebate check in the mail, perhaps a lump sum deposit into the account that you use to pay the premium, or a direct reduction in future premium. If for any reason that you receive a rebate from your insurance company for a portion of yours or your eligible survivor's medical plan premium, you must notify LACERS of the rebate and provide supporting documentation. Any rebates of any amount received after your LACERS MPRP reimbursement will result in excess reimbursement, and this must be paid to LACERS. Any excess reimbursement that is not repaid will be included in your taxable income and reported to the Internal Revenue Service. Medicare and MPRP. So upon turning age 65, as required by LACERS, you will have to enroll in Medicare. For retirees who enroll in both Medicare Parts A and B, LACERS will reimburse your Medicare Part B basic premium in addition to the reimbursement for the medical plan premiums that you claim. Note that if you change from a LACERS sponsored plan, you'll notice that you are reimbursed for your Medicare Part B premium on a monthly basis. Now, if you enroll in the LACERS medical premium reimbursement program, the Medicare Part B reimbursement will be part of the quarterly claims process. So instead of that reimbursement for the Part B premium being every month, it will also be on a quarterly basis. So that's definitely something to know. Additionally, you must pay for any Medicare Part B and Part D surcharges that are assessed by CMS, or your Medicare Part B and D enrollment will be canceled. LACERS does not apply your medical subsidy towards or reimburse to you any Medicare-related penalties, such as late enrollment penalties, or surcharges, such as the income-related monthly adjustment amount. Earlier, we had a question regarding what if you don't qualify for Medicare Part A and you are required to purchase it as part of enrollment for your non-LACERS health coverage. So in that scenario, your Medicare Part A premium can be reimbursed to you, but as part of the eligible maximum subsidy amount for which you receive. So it is involved in that calculation. So if you only qualify for Medicare Part B, but you enroll in non-LACERS senior advantage coverage, and they require you to have Part A, will reimburse you for your Part A that you enroll in and have to pay, but only up to your maximum subsidy amount. And lastly, eligible survivors and MPRP. So your eligible survivor is eligible to continue or enroll in the MPRP after your death. Your eligible survivor must submit a new application, including the following documents, and they're the same for regular enrollment into the program. They would include the Medicare or the MPRP enrollment form, the certification of dependent or survivor status for health coverage form, and you'll be checking the box for eligible survivor or eligible domestic partner. A copy of your medical insurance certificate, copies of your medical, prescription drug, and vision ID cards, copy of your Medicare card if you're eligible for Medicare, and a summary of benefits for your non-LACERS medical plan. Note that LACERS does not reimburse survivors or dependents any part of their Medicare Part B premium. Okay. To be eligible to be considered as an eligible survivor, again, some of the basic requirements: you must be married 1 year prior to retirement, married on the date of retirement, and married after the death of the employee. Okay. And so that concludes our presentation. And now we'll have the live Q&A session. Okay, so one question that we have here: would my Medicare Part B premium be reimbursed as discussed if the VA is a qualified plan? Yes, the VA is a qualified plan. And so you would be reimbursed your Part B premium as long as you have Medicare Parts A and B. Okay, so one question we do have: I moved to Arizona. I'd like to know if my husband's insurance qualify under the MPRP. Works for the state of Arizona. His plan may qualify for MPRP. The best thing to do would be to obtain a copy of the summary of benefits and submit that to LACERS health staff to review. And then we could confirm whether or not it would be eligible for reimbursement. I believe it should if he works for the state of Arizona. Okay. Is there a breakdown of the premiums somewhere in the MyLacers website? So in terms of the medical premium reimbursement program, it's basically based on the eligible medical subsidy amount for which you're eligible for. In terms of out-of-state premium costs, we don't have any information on what that might be. That would be something that you would have to research on your own in the state that you're looking to move in, or the area that you're looking to move in, of what that particular medical plan might be. But in terms of the reimbursement, LACERS will reimburse you up to your maximum monthly subsidy amount that you're eligible for. So just for an example, and this is not the specific subsidy amount that is currently with LACERS this year, but just for an example, let's just say that your monthly premium or your monthly medical subsidy is $1,000. If your monthly premium that you're paying is $900 per month, LACERS will reimburse you up to $900. And the difference between the medical premium that you're paying and the eligible subsidy amount that you're eligible for, that is not any consideration of cash in hand. It's just a reimbursement up to the premium that you're paying. Okay. Question that we have here: if I qualify for reimbursement for Part B due to my spouse's eligibility under Social Security, will he get reimbursed, or how does it work? So if your spouse is a LACERS retiree and he has Medicare Parts A and B, he would get reimbursed for his Part B. However, if he is not a LACERS retiree and it's just you as the LACERS retiree and you qualify for Part B through your spouse, you will get the Part B reimbursement. Again, the Part B reimbursement is only for the LACERS retiree, eligible spouses or dependents who have Medicare and are covered on your non-LACERS plan. They are not eligible to receive the Part B reimbursement. It's just for the LACERS member. Does LACERS offer Part A? LACERS coverages are senior plans. They do have Part A coverage, hospitalization costs. So currently, if you are out of state and the only option would be to enroll in through LACERS would be the LACERS Anthem PPO Medicare preferred plan. That does have Part A coverage built into it. But if you're out of state and looking to move into the reimbursement program, you would of course have to research again medical plans or senior Medicare plans in the area which you're moving to, and see if those plans meet your medical needs, and two, meet eligibility requirements for this program. The subsidy amount for LACERS 2023. So it will be included in your health benefits guide, which you'll be receiving shortly in October. It'll also be posted on our LACERS website in just a few weeks prior to open enrollment. And in the subsidy amount would of course depend on your age, your years of service, and your Medicare status. So those are three kind of different limits in terms of what your subsidy amount could be. I believe for this current year, if you're under age 65 and you have 25 years of service or more, the maximum medical subsidy is $1,884.50, and then for eligible surviving spouses, that amount is $924. And then if you were a retiree or surviving spouse with Medicare A and B, that amount for your maximum medical subsidy would be $494.67. Again, the published amounts for 2023, they'll be included in the health benefits guide, which you'll be receiving prior to open enrollment. It'll also be posted on our LACERS website. There will be a soft copy of the 2023 health benefits guide available shortly. Moving to Virginia, how do I locate qualifying medical plans? So, you would have to just if you're moving to Virginia, you would have to research what medical plans are available. Unfortunately, LACER staff cannot really help you in terms of knowing what plans are available, because obviously that would depend on your zip code. The best thing to do would either be to, search for a medical plan, maybe through Google, or you could also look on the health insurance marketplace. Just again, be very careful that if you are going through the health insurance marketplace, that you do not accept health plan, a medical plan, federal subsidy, or tax credit. And if you have any other questions in terms of maybe locating specific plans, you could email us at Lacers. But again, we don't have any specifics on what medical plans are available in the area that you're going to move into. That's something that you need to research and find on your own. If you do happen to find a plan, you could always obtain a copy of a summary of benefits and submit that to Lacer staff to review, and if it meets eligibility requirements for the program. Okay, does the plan cover me if I'm out of the US for over 6 months? Okay, so if you happen to move outside of the country, unfortunately, the Lacer's medical premium reimbursement program would not be available to you. This plan is only available if you reside within the US and its territories. In terms of Lacer's coverage for out of state, we do have a Anthem PPO out of country sponsored plan through Lacers. The cost for the Anthem PPO out of country plan is the same premium amount for the regular Anthem PPO under 65 coverage. I believe for this current year, that premium is $13.37 and $99. And of course, the out-of-pocket cost to you would depend on the medical subsidy that you're eligible for. If you have interest in the Anthem Blue Cross PPO out of country plan, the best thing to do is to contact Lacer's health staff, and we'll send you an out of country information packet for more information on that particular coverage. From what I know, it does work on a claims basis. So if you receive coverage outside of the US, you would have to provide claims and submit that, I believe, to Anthem for reimbursement. So it's a little bit different than the reimbursement program through Lacers, because the medical premium reimbursement that we're currently covering today is again only for individuals residing outside of California, but within the US or outside of a Lacers HMO service area. Is there a master list of approved zip codes so I know what neighborhoods you can move into? I guess that depends on what area you're talking about. If you're referring to California, we do have zip code lists in terms of what areas in California may or may not have access to a Lacer's HMO medical plan. But in terms of anything that is out of state, we don't really have information on that. Again, if you're moving out of state and participating on this program, again, you would have to review and research on your own what medical plans are going to be available to you in those specific out-of-state areas and neighborhoods. Okay, let's see here. Meant to apply for MPRP, and do I have to cancel my Lacer's dental and eye coverage? So if you are currently on a Lacer's medical plan, All of our medical plans do have vision coverage already built into that. So if you are participating on the reimbursement program, you would have to cancel your medical plan, your LACER sponsored medical plan. And in the process, you would be canceling your LACER's vision coverage as well, because that's built into that plan. In terms of the dental coverage, you would only have to cancel your LACER's dental coverage if you were moving outside of California and you were currently on the LACER's Delta Care USA HMO dental coverage. Yes, then you would have to cancel that plan and either switch to the LACER's Delta dental coverage as an option through LACER's. And then the only other thing, if you wanted a different option in terms of dental coverage, you are more than welcome to enroll in non-LACER's dental coverage. Just know that if it's not the Delta Dental PPO, it would not be reimbursable under this program. Okay, and then we had a question here, something mentioned about possible taxable amounts regarding reimbursement. I guess for taxable amounts, you might have to be a little more specific in terms of the reimbursement for claims under this program. You know, we are reimbursing you up to what your medical subsidy is, and the LACER's medical subsidy is not taxable. So I'm not sure if that's the question that you're referring to. I think the other thing that I covered earlier was the rebates. So the rebates, the health plan rebates, again, you know, there's a threshold that your coverage is meant to sustain. So medical plans, not non-LACER's medical plans, it's what's called the medical loss ratio. So of every dollar that is collected by your insurance provider through premiums that you pay, from every dollar, 80 cents of that amount has to go towards paying for your medical care. So if they fail to reach that threshold, if they fail to spend 80% of the premiums that they collect, say they only spend maybe 70% of that on your coverage, that insurance company, they have the obligation to issue rebates to their subscribers. And again, that could come in the form of a rebate check. That could come in the form of a direct deposit to the account that you use to pay for your medical premiums, or it could come in the form of a future reduced monthly premium amount. And anytime that happens, you do have to report that to LACER's, because anything that is not repaid in terms of rebates that you receive, that will be reported in your taxable income. And I guess the reason why that is that, you know, if we've already reimbursed you in good faith for the premiums that you paid, and then the medical provider issues you a rebate, which is essentially another reimbursement for something that LACER's already provided you, right? Then that amount needs to go to LACER's. Otherwise, it could be considered as a taxable income. If you have any kind of future questions regarding that or want more clarity, definitely feel free to email us at LACER's Health, and or give us a call and we could go over that with you.
Glenn, I'm afraid that's probably the last question we're going to have time for.
Okay.
We're pretty much at the end of the hour. So everyone, I do want to thank you for attending today. Glenn, thank you so much for the presentation and for the information. Eileen, thank you so much for helping to address questions that came up during the session. For anybody who still has any outstanding questions about MPRP, I urge you to visit our website, lacers.org. There's a whole section about MPRP. You will find today's slides uploaded there into for download in that section. And then, as I mentioned, today's session has been recorded and it will be available on our YouTube channel probably within the next week or so. If there are any outstanding questions, you see our information posted right here. Email us at lacers.health@lacers.org for any health-related questions, or for any general questions, lacers.services@lacers.org. That's going to round it off today. Thank you again to everyone. Hope you have a good day and take care.